Hey, this is Dr. Story. I had a patient today who had a bicep tear. So the bicep is the muscle in the front of your arm, and in this particular patient, the tendon up in his shoulder actually ripped. The muscle tore in his shoulder, and he's got a big ball at the bottom of his elbow. What's interesting is because of the visual deformity, you'd think to yourself, holy cow, you have to have surgery on this. I'm going to give you an alternative view of whether you should have surgery. Now, let me go back and say that I've seen many patients with bicep tears where their bicep actually rips off their bone, and they've not had surgery and they've had very functional lives. It's not the most appealing look, but you can live a life without a bicep, and I'm going to tell you why. Now, most of the time when the bicep tears in the shoulder, it's a degenerative condition. This person has had a rotator cuff problem for a long period of time, had tendonitis of the bicep tendon for a long period of time, and I always tell patients it's like a rope that's gliding over a jagged rock, that rope is the tendon, and as time goes on, it just starts to shred that tendon away until it finally rips. In that particular case, if it tears in the shoulder, the bicep will roll down into the person's elbow. Now, you'd think to yourself, well, without a bicep, how does a person lift their arm? All of these patients, once the pain is gone, they actually do not have any trouble lifting their arm because there is another muscle underneath the bicep, and it's called a brachialis. And for most activities that we do in our daily life, you really only need that brachialis. Some people, I've had a number of patients say to me this, that they had terrible pains in their shoulders when it was inflamed. Once it tore, the actual pain went away. Now, these patients went to orthopedic surgeons, and the orthopedic surgeons actually told them to not have surgery, that the complications from the surgery, the potential for infections from the surgery, and also the success rate of the surgery is not worth it. Now, if you're a bodybuilder, you simply need that bicep attached to your body. If you're young and you have the bicep tear, and it's actually a healthy piece of tissue, not a degenerated tissue that's had tendonitis for 10 years, but healthy tissue, then you might have success with surgery. It really depends on what the surgeon tells you. The other type of tear, which is less common, but I've seen this as well, is where the bicep actually tears in the elbow, and then therefore the muscle actually rolls up. More often than not, this is a traumatic injury. Traumatic injury meaning the person fell down. I know someone who fell down and actually the crook of their elbow got caught on the ladder and actually tore their tendon. Well, they didn't have surgery either. And I know this is an unpopular topic because most people cosmetically, again, would want to have surgery. But what I'm saying is talk to your surgeon and also use some common sense. Is it worth having surgery if you can get by without it, other than a cosmetic deformity? So if you found this interesting, let me know, give me a thumbs up, and ask any questions in the comments section below. I'd be happy to answer them.